Hello and welcome. We are here in a continuation of our conversation with Dr. Richard Jefferson. What your experience with trying to do effectively non-exclusive licensing coupled to tiered pricing of technologies at Cambia has been?
It's incredibly positive, and it's interestingly enough, in spite of the rhetorical volumes and vitriol that gets spewed about this, most universities, the vast majority, make no money on patent licensing. The vast majority make no money. In fact, they lose money. It costs money to have a bunch of experts monitoring and patenting and building walls of exclusion around technologies and ideas. It costs a lot. And to pay for those people generally is not taken from the same pocket as the revenue that is generated. So people don't do their sums, or at least they don't allow the sums to be done. But if you do, even the data from the industry association that represents technology transfer, such as the Association of University Technology Managers, AUTM, even their data indicates that the vast majority, I don't know the number, but maybe 95% of public agencies lose money on intellectual property. So at the NIH, this woman, Claire Driscoll, and I were invited to Finland, to Turku, Finland, which was the site of the annual meeting of the Association of Science and Technology Transfer Professionals, which is sort of the European version of AUTM, which is largely North American. They'd asked us to keynote about this very issue, biological open source and non-exclusive licensing and public sector patent practices. And we actually ended up singing from the same song sheet on this. And she said something remarkable. She said, if a public agency really wants to make money on intellectual property, stop patenting. And there was, of course, what? And the point was that the differential between successful, if you would increase your successful federal granting by 1%, it would swamp the net revenue that universities obtain from patent licensing. Even the largest of them, the ones that are always held up as the paragons of patent licensing success, if you look at that proportional to their contract revenue from federal government competitive grants, it's very, very small.
But let me ask you a counterfactual history question. If you had dealt with the intellectual property that you've generated within your own organization, in the traditional patent and exclusively licensed, perhaps to Monsanto, perhaps to Syngenta, and in the tried and tested orthodox mode, would either revenues and or dissemination have been different from the way you have it today?
Oh, yes, certainly.
And in what sense?
Well, as Dan Quayle said, prediction is very hard, especially about the future. So it's going to be a challenge to say what it would have been like, but I can speculate. Since you're inviting me to, why not? The idea of exclusive licensing probably would have caused a much greater monopoly. Assuming your technology is actually useful, exclusively licensing it denies its access to a variety of other players that could have been a useful social force to keep monopolistic behavior at bay. I'm a passionate disbeliever in monopolies. I think that there's probably no more insidious enterprise than a monopolistic enterprise. If it's one that affects the ability of people to solve problems and make decisions, it's even more contestable in my view. So exclusivity in general, other than those few cases where a very substantive case can be made for securing very substantial investment by no other means, I think should be issued. There's no doubt. Had we licensed our core technology, GUS, exclusively, it would have been potentially setting back the field several years, not because it was such a breakthrough technology, but because it was the only one that did what it did at that time. And people needed that tool to be able to ask sensible questions about plant biology. Now, what we wanted to have happen from the use of the tool was that we would get more context-dependent science for agriculture that would actually explore dramatically different modes of agricultural science, including looking at systems biology and the performance of complex systems, not monocultures. That's what we wanted to have happen. But one of the things you can't do in technology sharing is control. You can encourage, you can shape, but ultimately people will do what is in their best interest to do. So the exclusive license would never have fostered that worldview of seeing a diverse set of users competing with each other. So non-exclusive was critical. But the question is, do we even really need licenses per se? Do we have to look at it always as we first draw metes and bounds around permissions and then deny them selectively based on ability to pay? I don't even think that should be the dominant paradigm. We should actually reflect on whether a particular intervention, scientifically or technically, is either pre-competitive, meaning it's something that everyone really could use to further the advancement of both their agendas and societies, or if it's a market failure. If you look at some of the diseases such as tuberculosis, which is the topic that brought me here to Delhi today, to work with the remarkable open source drug discovery efforts that Zakir Thomas and others at CSIR are leading, or malaria, or other diseases or problems that are thought to be classical market failures. In fact, to be honest, climate change and environmental management really are such market failures. The question is really, should we look at them as ways of how do we extract revenue from this, or should we say that there are certain classes of intervention as a society that merit special treatment? If a market failure or a pre-competitive platform, which I view as sort of the vertical and the horizontal of technology, merit special treatment because they make a more efficient society. And efficiency is often held up as a pejorative. Like you almost imagine Dilbert cartoons and efficiencies and very inhumane and inhuman interpretations of efficiency. But actually, it's a way of getting rid of the waste that stimulates poor practice. So if we can make it cheaper to solve problems, then more people will be engaged in the process, and they will put their own imperatives and their own incentives.
In such a model, what happens to platform technologies? Technologies that are essential, sometimes in unexpected ways, for solving problems in a socially relevant sector?
That's a wonderful question. Let me give you two incredibly interesting examples. Now, as biologists, as we both are, we appreciate that two of the core discoveries, I wouldn't call them inventions, but no, actually, let's call them inventions since they would be eligible for patent protection, would be DNA sequencing, no doubt, and monoclonal antibodies. Now, both of these interventions were made by truly brilliant scientists, and not a single patent was obtained in the original process. So Fred Sanger, who developed the most important DNA sequencing technology at the Medical Research Council labs in Cambridge, never sought patents for the dideoxy DNA sequencing technology. Now that fostered the development of many instrumentation companies that took improvements on that, and they took their own patents, but that's okay because they competed against each other and brought the cost of DNA sequencing down dramatically, which is what competition should do. Fair enough. That was a critical platform technology that was needed by everyone, which was handled in a true public domain way. Now, what's nice about public domain is it costs nothing. I mean, you don't have to pay lawyers, you just put it out there. How you put it out there matters, but it's out there. The other one, monoclonal antibodies. Kohler and Milstein, scientists that I'm sure you're familiar with as an immunologist yourself, made a breakthrough in understanding how to perpetualize antibody-producing cells. Now, this was critically important in being able to understand how the immune system works and how to make reagents that could treat disease and diagnose disease. It's been a tremendous boon to modern medical science. That also wasn't patented. And again, many people took elements of it, patented them, but okay, they competed with each other, but the basic core platform was shared. Now, those are recent examples that had utterly disruptive effects in a positive way on society and on science, and they were handled in a very low-cost way that was very positive, the public domain.
But we are really looking at them retrospectively and identifying them as platform technologies. How does one prospectively make such a call about a given technology that one is developing, and how does one decide whether it is a cross-platform technology important for many sectors, or whether it is something that is far more focused?
I guess the only point I would raise is that we have to add the human factor in here. People talk about science or many other enterprises as if they are wind-up toys. They work in a particular mechanistic way, and there are formulaic approaches to it. But in fact, one of the great true potentials of science that has not been properly promoted is integrating it with human value and imagination and generosity of spirit. The most remarkable science I see is not that done by self-promotional and very, very important scientists. It's done by generous scientists, scientists who actually care passionately about the uptake of their work product and who care about other people. And what I find is that when you couple imagination with a generosity of spirit, you have a tool to make those decisions. It's not an easy tool to train, but if you begin training students with the understanding that science is not a clinical profession, by clinical I don't mean, I shouldn't have used that word talking to a medical professional, but it is not a cut and dried, undisciplined profession that needs no human and organic element. We need far more engagement with society by scientists, because then they will be informed in almost a subliminal way about how to make such decisions more wisely. We'll always make mistakes in these decisions, always. That's just the nature of the human condition. But the ability to engage that human condition in the process of deciding is very important, and I think missing in science education.
On that note, and I couldn't have said it, I couldn't even have imagined it being said better. We thank Richard Jefferson for being here. Thank you very much.
Thank you. It's a delight to be here.